You're extremely mentally unwell, a hospital, not a prison, is the right place to care for you. Sometimes even those who've committed no crime end up in a cell. It's a legal last resort when there's no mental health bed available. Today's report reveals prisoners becoming severely ill and patients brought in because there's nowhere else for them endure months of suffering behind bars. The Chief Inspector of Prisons, Charlie Taylor, says in almost every adult jail he's set foot in, he's seen desperately unwell people held in the bleakest of conditions. Those so driven to harming themselves, they've repeatedly blocked their own airways with bedding, removed teeth, or maimed themselves to the point of exposing their own intestines, frequently causing life-changing injuries. At Eastwood Park Women's Prison, Charlie Taylor found acutely unwell women held in appalling conditions. The bloodstains on the floor and scratch marks on the walls, grim testament to their distress. The inspector said they were under the care of prison officers with little or no training in mental health. Delays in referrals and assessments by psychiatrists mean most patients are left to linger in prison far longer than the 28 days the Mental Health Act recommends. On average, people waited 85 days, nearly 3 months, to be transferred to hospital. One patient was stuck in prison over a year. Today's report says delays in accessing the proper mental health care can cause irreversible harm. One forensic psychologist who's worked in prisons agrees.
I've worked with people who have struggled to get across into the mental health care system. And unfortunately, this isn't people who can be managed with the mental health needs in prison. This is people who really their needs are very acute, they cannot be safely managed, and they pose risks to themselves and others.
We're like teachers, counsellors, all rolled into one.
Jails are overcrowded and understaffed. The prison service has been on a recruitment campaign.
Search prison jobs now.
Staff, sometimes without the right training, are being expected to care for those with psychosis and paranoid delusions. Some have been injured by violent patients. Today's report says action is needed to reduce harm to patients, but also those struggling to look after them.
Decisions to change this country for the better.
A draft mental health bill which sought to stop people being sent to prison for their own protection never made it into the King's speech. The Howard League for Penal Reform is calling on the government to resurrect it and end what it calls the scandal of putting mental health patients behind bars.
I mean, prison wouldn't be good for anyone's mental health, but if you're already in a mental health crisis, then it's about the worst place you could possibly be. And really, it should never have been considered as a place of safety. And I think particularly not so now that we are in the end in 2024. We should be able to do better than this.
Today's report from the Prisons Inspector is grim, but it's not a new warning. The Chief Inspector points out he's been raising the alarm about delays getting mental health patients out of prison for nearly 2 decades. He concludes it should be a priority, but it's not.
Well, I'm joined now by Charlie Taylor himself, who is the Chief Inspector of Prisons. We heard some of the incidents that you found there. Just give us a sense of how shocked you were and your team by what you discovered.
Well, Eastwood Park is a women's prison in South Gloucestershire. And I arrived at the jail and the team said, you've got to go down and look at House Block 4. You've got to go and see what's going on in there. And what we found was absolutely horrific. We come across some pretty shocking things as we walk around prisons, but I've never seen anything like that. It was really horrifying, where there was one woman who was repeatedly running against the wall of her cell, banging her head against the wall, harming herself in an extreme way. And what really worried me was the gap between the staff who were doing the best they possibly could, but without the skills or the expertise or the knowledge to be able to care for those people, and the extreme needs of the women who were locked up.
It sounds like something from another century, really.
Yeah, there have been places where I've walked around segregation units, where I've walked around medical facilities in prisons, and it feels like an example of a sort of Victorian version of Bedlam. It's horrific.
And I mean, what shocked me from reading the report was that some of these cases that you considered had not been convicted of any crime. Some had been, but all, as far as I understand it from your report, in your view, should have been in a secure hospital instead of prison. Is that right?
That's right. And just to be clear, these are people who are desperately unwell. Sometimes I came across one guy who thought he was in a submarine, didn't even realise he was in prison. People hearing voices, people suffering from psychosis. These are people who are really unwell. These are not people with anxiety or depression. These are people at the most extreme end. And as a result, it's having an enormously damaging effect on them, but also on the people who are working and desperately doing their best to try and look after them inside.
And society as a whole, which I'll come back to in a minute.
Indeed.
But, I mean, some you found have waited more than a year to be transferred when it's supposed to be, you know, a few weeks. Is it always, as ever, down to resources? There's just not enough beds in a secure mental hospital?
Well, that is the case, and it's certainly the case in some bits of the country. But actually what we also found, and this was really frustrating, that there are bureaucratic processes that just get in the way, where people seem to go back to square one if they don't get into a certain hospital or the provision isn't deemed to be right for them. So rather than this being a streamlined process that gets ill people where they ought to be, what we're finding is people languishing in prisons and often in segregation units.
So could some of those bureaucratic problems be fixed without any extra money?
Yeah, we absolutely think they could do. The other thing that worried us about this is about accountability. It's not clear who's accountable for this. Whose job is it to make sure that people get to hospital within those 28 days?
There were legislative changes proposed that weren't in the King's speech. So obviously it's an election year. Are you hopeful that some of these issues concerning mental health and prisons might get debated in an election campaign or not?
Well, I hope so. I hope this is something that, whatever the result of the next election, that the new government comes in and takes this really seriously, because we can't go on with the situation that we found. It's been going on for a long period of time now, many years.
Well, spell out the cost then to society, because a lot of people might struggle to find any sympathy for people who are in jail, even though, as your report points out, some of them have not been convicted of any crime. So what is the cost to society? Why do we need to take an interest in this?
Well, absolutely. I mean, even if you had no sympathy at all for these incredibly unwell prisoners who end up in prison, you would have sympathy for the prison officers who are trying their best to look after them. But also, most of these people are going to come out at some stage. And if instead of getting the treatment that they need, their condition has deteriorated over time, then when they come out, they're a greater cost to society, but they're also a greater risk to the rest of us.
So the investment is required now, really.
Absolutely. You wouldn't leave people with a broken leg. You wouldn't leave people with a physical injury waiting before you gave them treatment. But what we're seeing is people waiting 462 days in one case before someone was made a transfer to hospital. So being kept in wholly inappropriate conditions.
And staff must be terrified, the staff that you spoke to.
Staff are remarkable. They're courageous. They come to work every day and do their best, but they're not equipped. And also, sometimes what's required is that prisoners are forced to take medication. Well, that can't happen in prison. That can only happen in hospital. So you've got people, because of their psychosis, who refuse treatment, but that treatment cannot be given in prison in a way that it could be in hospital.
Yeah, legally, they have to be in a secure hospital to be forced to take the medication.
Indeed.
Charlie Taylor, thank you very much for joining us.